Good morning. This is John Jones with NuSpine Chiropractic, and today I got an excellent interview guest, Dr. Travis Downs from our clinic in New Braunfels, Texas, one of our fastest growing clinics in the entire country. Way to go, Dr. Travis, and thank you so much for joining me today. How are you?
I'm good. Yeah. And it's not just me. We have a whole awesome team here. So it's teamwork makes the dream work. That's what we like to say.
That's right. No doubt. So let's get to know you a little bit. So tell me a little bit, how did you become a chiropractor? It's a pretty unique niche for a career. How did you become a chiropractor? How did you make that decision?
Well, I started going to the chiropractor when I was 3, but wasn't all consistent with that, but we started going when I was little. And actually my sister's a chiropractor and she went through chiropractic school. And I was originally going to be a veterinarian and then decided that wasn't my choice. That was what everyone wanted for me. And I went back to Odessa for a couple of years to figure out what I was supposed to do. And then me and my sister crossed paths again because she had already graduated chiropractic school for a few years. And then she showed me some things. And I was like, this is super cool. And I already believed in everything. And so then I went and then ended up staying in Dallas for, 12 years or so. I worked for a couple of people in my own practice for about 8 years. And then after rebuilding that thing after COVID, I was just kind of tapped out a little bit. So moved down here to New Braunfels, took a little time off, and then got back into it because after 6 months, I got a little bored and then met with Chris, and then here we are.
Yeah, well, we're so glad you're with NuSpine. So I guess families get together and at the Thanksgiving table, you guys are going around adjusting everybody. Is that how it works with you and your sister?
Only when I was in school. And now I'm like, they know that.
Yeah. I know you treat a lot of patients in the New Braunfels, Texas community. What do you find to be the most rewarding part, as a physician treating patients?
Well, it's not just like when they tell me they feel better. It's just when they say, now I'm able to, go play with my kids and go work out and do the things that they enjoy doing. That's the main thing I focus on. Not just get you out of pain, is keep you doing what you love to do. I use my dad as an example because, he's been a welder in the oil field my whole life, and he worked his tail off to provide for us. And, but he's stubborn West Texas man, right? And so now he's 66. He still works, but and now he's got double knee replacements and his feet are all kind of jacked up, and he has trouble walking and everything. And so he still goes to work, but then he comes home and my mom's like, he needs to retire, but I don't want him to because he's the grumpy old man when he comes home. And then we used to play golf together, and now he hasn't played golf in I don't know how many years, maybe 10, something like that. And so, what we do now as young men, young ladies, pays dividends in the future. And so that's the thing I try to get to them and, put that thought process in their brain that, you have pain now, but the more you take care of it, it pays dividends in the future. They all know someone that's quality of life isn't very good, and they've seen it, they watch it, and they don't want it. So that's
Doc, I'm just curious, are there any particular ailments, symptoms that you are finding are most common? I know there's people come in for a lot of different reasons, but what are you finding are some of the main culprits that are, plaguing society?
The main ones are obviously people in their neck, right? So when you say yes to a patient, like, if you had any whiplash incidents, they only think car wrecks, right? But we start getting those little whiplash accidents when we're little kids, when we're starting to walk and we fall all the time and we fall out of trees. Everything starts from a little. So my background is actually corrective care. So I took x-rays on pretty much everyone. And so I've seen almost everything under the sun. I don't say I brag, but I used to try to guess what people's x-rays would look like. I got pretty good at it, but I would say 98% of the population has a reverse curve in their neck and it shifts out in front. Ladies complain that they have the hump, right? They hate the hump in there. And so then they sit at the computer. So it's mainly everyone's got their jacked up neck, and then that typically gets worse because what they have going on in the low back as well. Getting the leg injuries, and I used to find about a third of my patients had a slight short leg. I'm talking about 4 or 5 millimeters. So you just naturally walk on uneven ground. So it starts torque, scoliosis, and then when this is forward, it just causes havoc on the whole system. Right. Those are the main things to there.
Yeah. But I know obviously every patient is different, right? And there's different levels of symptoms, pain, and so forth. We're a wellness clinic, and when patients come in with a fair amount of pain and some discomfort, doctor, tell us, how long does it actually take, right? I mean, is there kind of a norm, or what should people expect in terms of, what it would take to start feeling better with chiropractic care?
Feeling better is typically, I would say, fairly quick. Sometimes it's 1 or 2 adjustments. A lot of times it's a couple weeks. But if you look at the neck research to really get it feeling better and like where it's not going to come back. It's around 20 to 24 visits, and that's a couple of times a week with that one, you know. And then obviously we're a wellness type clinic, and you have to meet people where they're at because some people can only come once a week. And so, you know, it's just the communication thing. Like, you have to stay on top of those adjustments. It's going to be a slower process, so they don't get frustrated with it. But everyone varies from person to person. You have to tell them that, and then you give them their little, you know, make sure they're icing, little things that you find that they could do at home as far as like how they're sleeping. You kind of, you know, give them a little bit of homework assignment if they want to get better faster.
Right. In the chiropractic world, we have a term we call, maybe you use it with your patients, maybe you don't, but we have a subluxation, right? Explain to us what a subluxation is and why it's important to try to, you know, rectify the subluxation in its early stages.
So subluxation, just I like to say, life happens. You know, we beat ourselves up. We have repetitive motions. We do the same things over and over again. And so that causes those joints to get stuck. And so they're just not moving right, especially the transitional areas, which is your occiput, your CT junction, the TL junction, and your L5-S1 area. And then those areas on top of that have 4 to 5 times more proprioception in the joint. And so the more you keep those moving, it helps basically unlock the rest of the spine. But subluxation is just that joint that gets stuck. And the longer it stays stuck, especially after about 2 weeks, is about what we know when that inflammation starts to build up. And when that inflammation reaches a threshold, that's when we actually start to feel the symptoms. That's why pain's the last thing to show up, first thing to go away. Right. But then the longer that sits there is actually how we get arthritis and degeneration. And you get a lot of patients, they're like, oh yeah, they just said that was normal. Yeah, it's normal because everyone has it these days, but it's not actually normal for our spines. Right. But you kind of have to twist their mind on that stigma that they've been taught that actually not normal. And you know, I've actually seen an actual 96-year-old that her neck looked perfect. I mean, the rest of her spine was pretty messed up, but she had a perfect neck with very little arthritis in there. And of course, she grew up and lived in Europe, and so she didn't have a computer and a cell phone and all that stuff. She was gardened and did her thing. It is possible if you take care of your spine to keep those joints healthy, and then that lets the nervous system work like it's supposed to, and then your body can heal and function like it needs to.
Awesome, Dr. Travis. I want to ask you, in New Braunfels, Texas, for local people, tell me exactly where you are, what plaza, and what's your new patient offer right now for people that might want to come in?
We're in Creekside, next to the men's warehouse and kind of in front of the Dick's Sporting Goods right there. And then we have a $29 new patient special. That's the exam, consultation, adjustment. If we're able to do that adjustment, depending on what's going on, then we get the hydrotherapy after that. And then I like to say we're warm, we're friendly. We want you to feel like you belong here and not just a number, right? So our goal is to keep you doing what you love to do. And that's the ultimate goal in life. If you're not having fun, then change that, let you have some fun.
Yeah. No doubt. I know you're impacting lives out there. Awesome. All you hardworking folks out there in New Braunfels, Texas, if you have an opportunity to go down and see Dr. Travis and the team, you'll be in great hands at our award-winning clinic at NuSpine. So make sure you go see Dr. Travis Downs in New Braunfels, Texas. Doc, thank you so much for your time today and your insights. Appreciate you.
Thank you so much.